The ER at St. Anselm hummed in a tired, fluorescent rhythm. Monitors pulsed, wheels rolled over scuffed tile. The rain outside tapped steadily against the ambulance bay doors, wind pressing against the glass as if trying to get in. Mara Quinn was already there when the clock turned 1 a.m. Her new badge still caught the light too cleanly. The plastic edges had not yet dulled. The photo showed a woman who looked younger than 31. Quiet, unthreatening. She moved through the supply room without being asked. Expired IV kits were pulled and replaced, gauze restocked, suction tubing aligned in clean rows. She corrected 2 chart audits left incomplete by the day shift, closing loops that would never be traced back to her. No one thanked her. That was expected. At 1:17, the head nurse, Carla, walked past with a clipboard tucked against her chest. "Quinn," she said without looking up, "you're on hallway beds and discharge paperwork tonight. Keep it light. Let's see how you handle something easy." "Yes, ma'am," Mara answered softly. Easy meant invisible. At the central station, a senior resident leaned back in his chair, watching her cross toward Bay 7 with a tray of saline flushes. He smirked when he saw the faint tremor in her hands. "Careful," he said to no one in particular. "She freezes when it gets real." A nurse nearby laughed, not loudly, just enough. Mara did not react. She adjusted her grip. The tremor settled. In Bay 7, a middle-aged man waited for discharge after a minor laceration repair. Mara checked his dressing, voice low and steady. "Any dizziness?" "No." She removed the IV smoothly, applied pressure, taped gauze with precise angles. Her hands did not shake when they were needed. They only shook when eyes were on them. Back at the station, she reviewed a medication order for a different patient in the hallway. The resident had charted a dosage of labetalol that did not match the patient's weight. Not dangerous yet, but trending that way. Mara recalculated silently. She cross-checked the chart. She walked to the medication drawer and adjusted the dose before it left the counter. No announcement, no correction spoken out loud. The patient's blood pressure stabilized an hour later. The resident nodded at the attending as if it had been his clean call. Mara watched the monitor instead of the credit. She moved through the ER like she had been there for years, not in ownership, in awareness. Every exit door hinge. The way the ambulance bay camera blinked every 12 seconds, the blind spot near radiology where the hallway bent just enough to hide a body. Security tonight was thin. 1 guard inside, 1 in the lot. The ICU was full. 3 hallway beds overflowed into triage. She said nothing. At 2:03 a.m., a trauma physician entered the bay, where she was adjusting an IV pump. "You're slow, Quinn," he said flatly. "In trauma, slow gets people killed." She met his gaze for half a second, then lowered it. "Yes, doctor." He stepped closer, lowering his voice just enough for it to sting. "Administration is watching new hires closely. 1 mistake, and you're gone." "I understand." He left before she finished programming the pump. She exhaled through her nose once. Slow was relative. In the field, rushing killed more people than hesitation. But she did not argue here. Not in a hospital that did not know her history. Not in a place where survival meant staying unseen. Anonymity required discipline. Discipline meant swallowing pride. She returned to the nurse's station and continued auditing discharge instructions for a patient with atrial fibrillation. Minor edits, corrected times, clean documentation. At 2:21 a.m., the dispatch radio crackled. The tone changed first. Not the words, the tone. Carla looked up. "St. Anselm ER, inbound private transport, male patient, civilian attire, possible internal trauma, security requested, minimal identifiers provided, walk-in VIP." The resident rolled his eyes. "Great. Politician with a headache." The radio continued, quieter this time. "Advise controlled intake. Escort will remain with patient." Escort. Mara's eyes lifted slightly. She did not move faster. She moved differently. She shifted the trauma bay configuration by inches, pulled a portable ultrasound closer to the bed instead of leaving it docked, checked suction pressure twice, positioned a blood warmer near the wall outlet instead of the center line. No one noticed. Carla frowned at her. "Why are you setting up trauma too? It's just a walk-in." "Making space," Mara replied. The rain outside intensified, wind rattling the ambulance doors. Somewhere in the lot, engines idled, low, steady, controlled. Security walked past the nurse's station without joking for once. The radio clicked again. "ETA 3 minutes." The resident stood, adjusting his coat. "Let's get this over with." Mara stepped toward Trauma 2 and checked the airway cart one more time. Her hands were steady now. In the reflection of the glass cabinet, her face did not change, but her breathing did. Slow in, slow out. Outside, engines kept running. The ambulance bay doors opened without shouting. No frantic paramedic report, no raised voices, just controlled movement. 2 men in dark civilian jackets pushed a gurney through the threshold. Their clothes were plain. Their posture was not. The patient lay flat, one hand resting loosely over his abdomen. No wristband, no hospital bracelet. The intake form clipped to the rail listed a temporary alias. Age approximate. Mechanism of injury. Fall. No clear ID. Private transport, one of the men said. He slipped. His voice was calm. Too calm. The resident exhaled sharply. "Fantastic. Another drunk with friends who don't want paperwork." The men did not respond. Mara stepped closer, glancing first at the hands of the escorts. No rings, no watches, no fidgeting. She shifted her focus to the patient. His boots were wrong for a civilian fall, military-issue soles, worn but maintained. Laces double-looped and tucked inward. His jeans were standard denim, but the way they sat suggested concealed weight once carried regularly. He was pale, not intoxicated pale, controlled pale. "Sir," Mara said quietly as she reached the bedside, "can you tell me your name?" He opened his eyes. They were clear, focused, not glassy. "Daniel," he said after half a second. The half-second mattered. His breathing was even, but shallow. Pain masked behind discipline. The resident began pulling at the blanket. "What happened? How much did you drink?" One of the escorts stiffened. "He fell," he repeated. Mara's eyes flicked once to the patient's abdomen. His hand rested there deliberately, protective, not random. His pulse under her fingers was steady but slightly thready. Blood pressure on the automatic cuff read borderline low. His shirt was dry. Too dry. If this was a fall, there would be visible bruising, external injury, something to match the pallor. There was none. "Pain level?" she asked. 6, he answered. He did not grimace. Most civilians overestimated pain. This man underreported it. The resident rolled his eyes. "Let's get a CT and call it internal contusion. He'll be fine." Mara lifted the blanket fully now. There it was. Subtle distension. Abdomen slightly rigid on the right side, guarding without theatrics. She pressed gently. He did not flinch, but his breathing shifted by a fraction. The escorts watched her hands, not her face. Her hands. "Sir," she said softly, "any dizziness?" "Not yet. Not yet." The phrase slid into place like a gear. She began routine vitals aloud. Blood pressure trending down, pulse narrow, oxygen 94. Normal words, calm voice. Inside her mind, the sequence formed cleanly. Occult bleed, possibly liver, possibly splenic, could be lower. Mechanism inconsistent with fall. The resident tapped the chart. He walked in. "He's talking. Let's not make this dramatic." Mara met the patient's eyes again. His jaw was tight, his breathing controlled. His friends had not given names. They had not stepped away from the gurney. She glanced at their footwear too, matching wear patterns. Practical, not decorative. Security had not asked questions. Interesting. The resident began ordering imaging without blood work. CT with contrast, he said. We'll clear him. Contrast. If he was bleeding internally and unstable, moving him before baseline labs could cost time. Mara hesitated. This was the line. Stay invisible. Or speak. She checked his pulse again. Slightly faster now. His abdomen felt warmer. She moved to the IV kit and placed a second large-bore line without announcing why. Efficient. Clean. Tape secured at a firm angle. The resident frowned. Why two? Protocol, she replied softly. He scoffed but didn't stop her. She hung fluids slowly, not enough to mask bleed, just enough to maintain perfusion. The patient's breathing stayed controlled. He was conserving energy. That was not civilian behavior. The resident began rolling the bed toward imaging. Mara stepped to the side of the gurney. Her mind measured timing. If he crashed in the hallway, the delay would be worse. She looked at the resident. "Doctor," she said quietly, careful to keep her tone respectful. "His pressure is trending down, and his abdomen is rigid. We should draw labs and cross-match before moving." The resident paused. The room felt smaller. "You're overthinking it," he said. Mara did not argue. She held his gaze for a second longer than usual. "His pulse pressure narrowed in the last 5 minutes," she added. "If this is internal, moving him without blood ready could delay intervention." Silence. One of the escort's eyes shifted to her. The resident clicked his tongue. "Fine. Draw labs. But we're not turning this into a trauma activation." Mara nodded once. "Yes, doctor." She moved fast now, but still looked slow. Blood tubes filled in clean order. Type and screen sent immediately. She tagged them herself and walked them to the runner. The patient's eyes tracked her again. Not the resident, not the escorts, her. When she returned, she adjusted the monitor slightly and leaned close enough for only him to hear. "We're watching you," she said calmly. "You're not alone." His breathing slowed by half a beat. The resident signaled to move again. Mara checked the monitor one more time. The numbers dipped by 2 points. Subtle, predictable. She looked at the resident and spoke one more time. "Doctor, if we go now and he drops in the scanner, we lose control. We should stabilize here." Careful, calm, respectful. The room held still for a moment. The decision hovered. Outside, engines continued idling in the rain. "You don't diagnose." The resident's voice cut through the bay without rising. Controlled irritation, the kind that believed it owned the room. Mara did not look up from the monitor. "I'm not diagnosing," she said quietly. "I'm asking for a type and cross before imaging." He stepped closer, lowering his voice but sharpening it. He walked in. "He's talking. We are not activating a trauma protocol because you feel nervous." Nervous. She let the word pass. Behind the resident, one of the escorts shifted his weight. The other watched the patient's face, not the argument. Mara kept her hands where they belonged, on the line, on the vitals, on the numbers. Blood pressure had dipped again, not dramatically, just enough to confirm what she already knew. Narrowing pulse pressure, skin cooling. The patient's breathing remained disciplined, but there was a slight delay now between inhale and exhale, micro-guarding. He was holding himself together. That did not mean he was stable. "Doctor," she said softly, eyes still on the screen, "his pressure is trending down and he's guarding on the right. We should run a fast exam before CT." The resident exhaled sharply. "You don't call imaging. I do." "Yes, doctor." She did not move. He hesitated for half a second. That was all she needed. The ultrasound machine was already positioned beside the bed. She powered it on without comment. The gel was warm enough. The probe steady. "I'm just checking fluid," she said, tone neutral. "For transport safety." transport safety. The phrase was deliberate. It framed the action as protection of the resident's plan, not opposition. He crossed his arms but did not stop her. The probe pressed against the patient's abdomen. Black pooled in the lower quadrant. Free fluid. Not a guess, not anxiety, reality. Mara did not react outwardly. "Doctor," she said calmly, angling the screen toward him without drama. "There's fluid." The resident leaned closer. Silence stretched. "Could be artifact," he muttered. She adjusted the probe slightly. The fluid line sharpened. The patient's pulse jumped to 110. Not from fear, from compensation. Mara shifted to his chest briefly. Breath sounds equal. No obvious pneumothorax. Back to abdomen. More fluid. "His pressure is 88 systolic now," she said. The resident looked at the monitor, then at the screen, then back at her. For a moment, pride and data collided. "Prep for blood," he said abruptly, as if it had been his thought all along. "Call lab." She was already hanging the bag. Large-bore IV secured. Saline slowed. Bloodline primed. She did not announce the sequence. She simply executed it. The patient's eyelids fluttered. His focus shifted toward her again. "Stay with me," she murmured quietly. The resident stepped back, pulling out his phone. "I'm calling admin," he said, voice tight. "This is a protected patient. If she activated anything beyond scope, I want it documented." Mara heard the words, but did not turn. If she stopped now to defend herself, time would be lost. The patient's abdomen tensed further. She increased the rate of blood slightly, controlled, not flooding. "Keep pressure stable," she told the tech beside her. "No sudden movement." The tech nodded. The escorts remained silent, but their posture changed subtly. Respect was not spoken. It was measured. The resident moved toward the hallway, already framing the narrative in his mind. Unauthorized escalation, new nurse overstepping, liability risk. Mara felt the weight of it without looking up. If she backed down now, the patient would crash in imaging. If she continued, she might be finished here. The numbers on the monitor steadied by 3 points. Small, enough. The patient's breathing deepened slightly. His eyes opened halfway. "Good call," he whispered, barely audible. She did not respond to that. Instead, she adjusted the transfusion rate and rechecked his abdomen. The fluid remained, but it was contained for now. The resident returned with the attending on speaker. "We're activating surgical consult," he said into the phone. "Internal bleed suspected." His tone had shifted. Ownership restored. Mara stepped back half a pace, allowing him the foreground. "Yes, doctor," she said. The attending's voice crackled through the line. "Get Orr on standby." The resident nodded, already typing orders. Around them, the bay moved faster. Lab runners hurried. The ultrasound machine hummed quietly. The escorts relaxed by inches. Mara checked the IV site once more and secured the tape. Her hands were steady. The resident glanced at her, irritation now layered with something else. Calculation. He would report this. He would frame it. But the patient was alive. That mattered. The monitor climbed back into safer territory. Blood pressure 94, pulse slowing, controlled. Mara stepped away from the bed and documented her actions in short, clean entries. Time stamps precise, no adjectives, no emotion. When the attending arrived minutes later, the resident summarized the case. Suspected internal bleed, initiated blood and fast, stabilized. He did not mention her name. Mara did not correct him. The patient's eyes remained on her as the team prepared to move him towards surgical evaluation. She met his gaze only once more, brief, professional, invisible again, but the save was real, and the cost was still coming. The administrator arrived before the surgical consult. He did not run. He walked fast, coat still damp from rain, jaw tight with contained irritation. He did not look at the patient first. He looked at the resident. What happened? The resident stepped forward immediately. Unauthorized escalation, he said. She activated blood without clearance and initiated imaging protocol outside her role. Protected patient. High liability. He did not raise his voice. He did not need to. The administrator's eyes shifted to Mara. She stood near the monitor, hands folded loosely at her waist. The patient's pressure was holding. The transfusion ran smoothly. "Did you override physician direction?" the administrator asked. Mara met his gaze calmly. "No," she said. "I reported hypotension. I requested type and cross. I performed a focused assessment within nursing scope." Her tone was steady, neutral. The administrator glanced at the resident again. "She touched restricted medication," the resident added quickly. "She initiated blood before I signed." Mara did not interrupt. Inside, she reviewed the timeline automatically. 0148, BP drop noted. 0149, verbal report to resident. 0150, resident paused for consult. 0151, blood request entered verbally. 0152, blood initiated. Every second was clear. She stepped toward the charting station without hurry. "I documented each action," she said. "Time stamped." She rotated the screen toward them. Clean entries. No emotional language. No defensive tone. Vitals trending down. Ultrasound findings recorded. Verbal order documented with time and physician present. The administrator read in silence. The resident shifted slightly. "She pressured me," he said. "She framed it like immediate failure if I didn't agree." Mara kept her voice level. "I reported the data." Nothing more. The administrator closed the chart screen. "This is a protected patient," he said. "Do you understand the exposure if protocol is violated?" "Yes," Mara answered. "Then why did you move ahead of chain of command?" "I did not move ahead," she replied. "I reported a trend. The physician made the decision." The resident opened his mouth. The administrator lifted a hand slightly, silencing him. The room felt smaller now. The patient remained the quiet center of it, oxygen mask fogging faintly with each breath. The administrator looked back at Mara. "You are new here." "Yes." "You were specifically advised to operate under supervision." "Yes." "And yet you inserted yourself into a high-risk case." "I responded to a blood pressure drop." There was no defiance in her voice, only fact. The administrator exhaled slowly. "Perception matters," he said. "Right now, perception is that you acted independently on a sensitive case." Mara did not argue perception. She understood it. Paper could wound deeper than shrapnel. The resident straightened, sensing ground shifting in his favor. "She has a pattern of hesitation and then sudden action," he said. "It unsettles the team." Unsettles. Mara felt that word settle somewhere behind her ribs. The administrator nodded once. "Step away from the bed," he said to her. She did. She handed the line over cleanly to another nurse without commentary. The transfusion continued. The administrator spoke in a tone meant to end things efficiently. "You are removed from the floor pending review, effective immediately." There it was. No shouting, no spectacle, just removal. Mara gave a single nod. "Understood." The resident's shoulders eased. The administrator continued. "Security will escort you to retrieve your belongings. Human resources will contact the board if necessary." If necessary, the phrase carried threat without heat. Mara looked once toward the patient. His eyes were closed now, stable for the moment. That was enough. "I would like to finish my documentation," she said quietly. "You can complete it in the office," the administrator replied. She did not push. Inside there was no anger, only assessment. Patient alive, bleed identified, blood running, risk contained, cost acceptable. Security appeared at the edge of the bay, not aggressive, just present. Mara removed her gloves carefully, disposed of them properly, sanitized her hands. The motions were precise, routine. She unclipped her badge without ceremony and placed it on the counter. The resident avoided her eyes. The administrator was already speaking into his phone about containment and messaging. Mara walked down the hallway without looking back. The fluorescent lights hummed above her. A tech glanced at her, confused. Another nurse stared down at a chart. No one asked questions. The locker room was dim and quiet. She opened her locker and folded her scrub top neatly before placing it inside her bag. Her hands trembled now. Not from fear, from adrenaline draining too quickly. She sat for a moment on the bench, breathing slow, measured. The same way she had before stepping into worse rooms. There would be paperwork, board review, possible suspension of license. She did not rehearse arguments. She did not compose speeches. She zipped her bag closed. When security entered quietly to confirm her exit, she was already standing. "I understand," she said before they spoke. They nodded. No hostility, just process. Mara stepped out into the corridor, rain tapping faintly against distant glass. She passed the nurse's station once more. No one stopped her. No one defended her. The patient monitor tone echoed faintly from down the hall. Alive. She pushed through the ambulance bay doors into the wet night air. The rain hit her face. Cold. Clean. Behind her, the hospital doors closed with a soft hydraulic hiss. No drama. No protest. She walked toward the parking lot as if she had finished a shift, as if nothing had ended. And inside the ER, the paper trail was already bleeding. The locker room was colder than the hallway. Fluorescent light flickered once overhead, then steadied. The hum felt louder now that the noise of the trauma bay was gone. Mara sat on the narrow wooden bench and stared at her hands. They were shaking. Not visibly violent, not dramatic, just a fine tremor in the fingers, like current still moving through them, adrenaline leaving the bloodstream. She pressed her palms flat against her thighs and breathed in through her nose, slow, measured. 4 seconds in, hold, 4 seconds out. The shaking eased but did not disappear. She peeled off her scrub top carefully, folding it with mechanical precision. No rush, no frustration. The movements grounded her. From the inside pocket of her locker, she took a small canvas pouch and slid it into her bag. It held one thing, a dull, worn coin with a ranger crest barely visible from years of handling. She did not turn it over. She did not look at the inscription on the back. She pushed it deeper into the bag and zipped it shut. That part of her stayed contained. Outside the locker room, the corridor carried a new sound. Low at first, then layered. Engines, not ambulance sirens, not delivery trucks. Heavier, idling. She paused, head tilted slightly, listening. Multiple vehicles, diesel, staggered arrival. Radios crackled faintly somewhere beyond the ER entrance. Boots moved with purpose. The tone in the building shifted. Security had been relaxed before, thin, almost casual. Now footsteps quickened, voices lowered. Mara stood and slung her bag over her shoulder. She stepped into the hallway. 2 nurses were whispering near the charting station. "Black SUVs," one said. "Federal plates," the other replied. "Administration's freaking out." Mara did not slow. She walked past them without asking questions. At the far end of the hall, she caught sight of the administrator from earlier. His posture was different now, less certain. Phone pressed tight to his ear. "No, we handled it," he was saying. It was an internal protocol issue. A man in a dark coat stood near him, hands folded behind his back. Calm. Watching. Mara lowered her gaze and kept moving. She chose the side corridor that led to the employee exit. Quieter, dimmer, less monitored. Her plan was simple. Leave. Disappear before anyone thought to review badge logs. No confrontation, no scene. Rain struck the narrow window beside the exit door. The parking lot lights reflected in wet asphalt. Her hand hovered over the push bar. Behind her, a monitor alarm spiked sharply from down the main hall. Short, urgent, then another. The sound cut through her like a memory. Hypertension alarm. She knew the pattern. Pressure dropping again. Her body reacted before her mind did. Shoulders tightened. Breath sharpened. She saw the patient in her head, pale, controlled, holding too much inside. He had been compensating. He would crash quietly. She closed her eyes for half a second. "You're fired. You're off the floor. You do not belong in that room anymore." Footsteps pounded somewhere behind her. A nurse hurried past toward the trauma bay. "Pressure's tanking," the nurse said to someone over her shoulder. Mara's fingers curled around the strap of her bag. If she walked out now, no one would blame her. They already had. The engines outside idled louder. Doors opened, closed. Radios snapped with clipped phrases. Something bigger than hospital politics was unfolding. She inhaled once, slow, disciplined. Her job had been to keep people alive. Titles changed, badges changed. That part did not. She did not turn back toward the trauma bay. Not yet. Instead, she stepped sideways into the shadowed alcove beside the exit door, where the wall recessed slightly around a supply cart. From there, she could see down the corridor without being obvious. Staff rushed past in fragments, a respiratory therapist, a tech pushing a cart too fast. No one looked at her. She set her bag down at her feet, but did not pick it back up. The alarms from the trauma bay flattened briefly, then rose again, controlled chaos. Her jaw tightened. Think, if she walked in openly, admin would escalate it into insubordination. If she left, the resident would double down on whatever plan he was already mismanaging. She needed information, not confrontation. Two security officers moved quickly toward the main entrance. Their posture had changed. Less casual, more alert. One of them glanced at her but did not register recognition. The dark-coated man she had seen earlier passed the mouth of the corridor now, speaking quietly into an earpiece. "Find her," he said. Not loud, but clear. Mara did not move. Her heart rate ticked up, but her breathing stayed even. Find her. The engines outside cut off, one by one. Silence followed, heavy and deliberate. The trauma alarm sounded again, longer this time. Mara stepped away from the exit door, not toward the main bay, not yet. She stayed near the wall, within reach, unseen, close enough to hear, close enough to move. She would not walk back in unless the moment demanded it. But she would not abandon the building either. Her bag remained at her feet, her shoulders squared. The hospital doors at the front slid open with a hydraulic sigh. Boots entered, and Mara Quinn stayed exactly where she was, invisible, waiting, ready. The convoy did not announce itself with sirens. It arrived in silence. Black SUVs rolled into the emergency entrance lane and stopped with controlled spacing, headlights cutting through the rain haze. Engines idled only a moment before shutting down in sequence. Security at St. Anselm moved too late. The automatic doors at the main entrance locked with a mechanical click. A junior guard hurried to the desk phone, unsure who he was calling. Inside, conversations thinned. The building felt watched. The first man through the doors wore a dark overcoat over a simple suit. No visible insignia, no raised voice. Two others followed, spaced deliberately, scanning without obvious aggression. He did not rush. He did not introduce himself loudly. He simply walked toward the administrator's desk as if he already belonged there. The administrator straightened immediately. A smile appeared too fast. "Good evening," he began, hand already extended. "We weren't expecting—" "You were," the man said calmly. Not loud, not hostile, just certain. The administrator's hand lowered. Doctors gathered near the nurse's station, posture shifting into performance. The senior resident adjusted his coat, voice tightening. "This is a hospital," he said to no one in particular. "We can't have—" The man in the overcoat turned slightly toward him. The movement was minimal, but it ended the sentence. He removed a small leather credential wallet and opened it just long enough for the administrator to see. No one else. The administrator's face drained of color. "Yes, sir," he said quietly. The man closed the wallet and slipped it back inside his coat. "How is he?" he asked. The administrator cleared his throat. "Stable. There was a minor complication, but our attending handled it." "Handled it," the man repeated, neutral. He scanned the room once, measured. "Who made the initial triage call?" he asked. The administrator hesitated only a second too long. "Our resident team, and the attending physician, of course." A nurse shifted uneasily behind the desk. The man's gaze sharpened. "I'll ask again," he said. "Who made the first correct call?" Silence stretched thin. A tech glanced toward the trauma bay doors. The administrator swallowed. "There was an issue with a nurse." The man did not blink. "What issue?" "She overstepped protocol," the administrator said quickly. "Acted outside her authority. We terminated her." The words hung in the air. Terminated. The man's expression did not change, but the temperature in the room dropped. "You fired her," he said. "Yes," the administrator replied, trying to regain confidence. "For misconduct." The man took a single step closer. "Where," he asked quietly, "is Nurse Mara Quinn?" The name landed like a weight. Several staff members exchanged looks. The resident shifted his stance. "She was inexperienced. She interfered. We handled it." The man's gaze did not move from the administrator. "Where," he repeated, "is Nurse Mara Quinn?" The administrator forced a thin smile. "She left the building." The man nodded once, almost to himself. Then his tone changed. Not louder, sharper. "You terminated a Ranger Battalion medic," he said evenly, "in the middle of a protected medical stabilization." The resident blinked. "Ranger..." The administrator's mouth opened, then closed. The man continued. "She identified the complication before your team did. She corrected your error without escalating it, and she did so while remaining within emergency authority." No one spoke. Rain struck the glass doors behind him in steady rhythm. "You were not treating a random civilian," he added. "You were stabilizing a protected asset whose presence here is not public knowledge." The administrator's composure cracked. "We were not informed." "You were not cleared," the man corrected. He turned his head slightly. One of the agents behind him spoke quietly into a radio. "Perimeter secure," the agent said. The administrator tried again. "She was fired because she caused disruption." The man stepped forward just enough to interrupt the thought. "Her removal," he said, "may have jeopardized an active operation." The words were measured, not theatrical, but they carried consequence. The resident's confidence drained. "I was following hospital policy," he said weakly. The man looked at him fully for the first time. "Policy," he replied, "does not outrank survival." The trauma bay alarm sounded again down the hall, a long, sustained tone. The man's jaw tightened. "Where is she?" he asked one final time. No one answered. The administrator looked toward the hallway, toward the employee exit corridor. Realization flickered too late. The man turned slightly to his team. "Find her," he said calmly. "Now." He did not raise his voice. He did not threaten. But the urgency was unmistakable. "Do not let her leave the property," he added. Agents moved without running. Controlled speed. Efficient. Security guards stepped aside instinctively. The administrator's face was pale now. "We didn't know," he said quietly. The man met his eyes. "You didn't ask." Down the corridor, footsteps approached the exit wing. The building felt smaller, tighter, and somewhere near the back hallway, Mara Quinn was still inside, waiting. The alarm in Trauma Bay 2 did not sound dramatic. It was a flat, sustained tone, oxygen saturation falling. Inside the room, the monitors told a story before anyone said it out loud. Blood pressure narrowing, heart rate climbing into a thin, dangerous rhythm. The patient's skin losing color beneath fluorescent light. The resident stared at the numbers. "That doesn't make sense," he muttered. It made sense, just not to him. The VIP's breathing changed first, not louder, shallower. A subtle retraction at the clavicle, a delay between chest rise and oxygen response, the kind of pattern that did not follow textbook decline. The attending stepped forward. Increase fluids, push another unit. That's not it, the resident said. It's probably sedation stacking. They began speaking over each other. The defense official stood near the wall, hands folded in front of him, watching without interruption. The patient's monitor spiked again, then dipped. The nurse currently assigned hesitated with the syringe in her hand. No one wanted to be the one responsible for the next call. Responsibility meant ownership. Ownership meant blame. In the doorway, unnoticed at first, Mara Quinn stepped back into the room. She did not clear her throat. She did not announce herself. She set her bag down near the supply cabinet and moved toward the bedside. The defense official saw her immediately. He did not speak. He simply shifted his stance half a step, creating space. The attending glanced up. "You can't be in here," he began. Mara did not answer. Her eyes were already on the patient's neck, subtle swelling near the original wound line, trachea shifting slightly left. Her internal logic aligned in seconds. Not fluid loss, not sedation. Pressure, air trapped where it should not be. The resident pushed another bolus anyway. The blood pressure dropped further. "Stop," Mara said quietly. It was not loud, but it cut through. The resident turned sharply. "You are not on this case." "His right lung is collapsing," she said evenly. "You're chasing blood that isn't the primary problem." The attending stiffened. "That's speculation." "It's tension," she replied. "Look at his neck." There was a half-second pause. The defense official watched the attending carefully. The patient's oxygen dipped into the low 80s. Time narrowed. Mara did not wait for consensus. She moved to the tray, gloves on, angled her body so the view of the procedure site was partially shielded from the doorway. Minimal exposure, minimal visibility. She kept her voice steady. "Prep, large bore, second intercostal space." The assigned nurse froze. The resident stepped forward. "You can't needle decompress without—" "Consent is implied," Mara said. "He will arrest." Her tone was flat, professional, not emotional. The defense official spoke once, quietly. "Let her work." That was all. The room shifted. The attending hesitated, but did not step in. Mara located the landmark with 2 fingers, counted silently, cleared the field in a single efficient motion. Her hands were steady now, no tremor. She inserted the needle with controlled pressure. For a fraction of a second, nothing. Then, a sharp release of trapped air, a hiss. The patient's chest wall eased slightly. Oxygen began to climb. 82, 87, 91. The monitor tone stabilized into a more forgiving rhythm. No applause, no dramatic reaction, just the quiet hum of a body given back its space to breathe. Mara secured the catheter and stepped back half an inch. "Prepare chest tube," she said calmly. "Right side." The attending moved automatically now, ego temporarily overridden by physiology. The resident avoided eye contact. As the procedure continued, Mara adjusted the oxygen mask angle and lowered her voice close to the patient's ear. "Stay with me," she said softly. "Breathe." No rank, no reference, just controlled reassurance. Her positioning shielded the patient's wrist from the wider room. From the official's line of sight, it was clear she was careful not to expose identifying marks. Protecting more than the airway, protecting context, protecting who he was. The chest tube was placed. Blood and air drained steadily. Color returned slowly to the patient's face. The room exhaled together. The attending cleared his throat. "We were about to do that." No one responded. The defense official's gaze rested on Mara, not grateful, not surprised, just confirming something already known. Mara stepped back from the bed and removed her gloves. Her hands trembled once, briefly, as adrenaline left her bloodstream. She folded them behind her back so no one would see. The resident spoke quietly to the attending. "We almost missed that." Almost. Mara picked up a pen and updated the chart in clean, minimal strokes. Time of decompression, response metrics, no commentary, no credit. The defense official approached her once the patient stabilized. "You recognized it fast," he said. She did not look at him. "It was visible," she replied. Behind them, the monitors settled into a steady rhythm. The immediate crisis was over, but in the silence that followed, something else shifted. The attending replayed the last 5 minutes in his mind. The resident avoided Mara's eyes entirely, and the defense official studied the room with new clarity. The save had been controlled, clinical, undeniable, but the pattern was now exposed. Someone in this hospital had nearly let pride override physiology, and someone else had stepped in without permission, without title, without ego. The patient was stable, for now. But the truth about who Mara was and what had almost happened was no longer contained inside the room. It had begun to leak. The hallway outside Trauma Bay 2 felt colder than it had an hour earlier. Not physically, structurally. Administrative presence changed air pressure in a hospital. Conversations lowered. Doors stayed half-closed. People watched from corners without appearing to. Mara stood near the nurse's station, charting complete, gloves disposed, badge still clipped, though her termination paperwork had technically taken effect. The administrator approached with a thin folder held too tightly. "We need to resolve this," he said, voice controlled but brittle, "before external agencies complicate matters." Mara nodded once. The resident stood slightly behind the administrator, jaw set. He looked steadier now that the patient was no longer crashing. "This can still be handled internally," the resident added. "You acted outside protocol. You re-entered a restricted case after termination. You performed an invasive procedure without attending authorization." His tone had regained shape. Confidence built on paperwork. The administrator opened the folder and turned it toward her. A printed statement, pre-written. "We just need you to acknowledge deviation from chain of command," he said. "Standard liability containment. Sign, and we can close this cleanly." Mara read the first line. "I, Mara Quinn, acknowledge that my unauthorized medical intervention—" She stopped reading. The hallway was quiet except for the distant rhythm of monitors. Her internal assessment was immediate. If she signed, the hospital shielded itself. If she refused, escalation followed. Her hands did not tremble now. They were still. The resident spoke again. "You were emotional, overconfident. That needle could have killed him." Mara lifted her eyes slowly. "No," she said calmly, "not placing it would have." Silence. The administrator's jaw tightened. "This is not about clinical debate. This is about institutional protection." From the end of the corridor, the defense official approached without urgency. He did not raise his voice. He did not announce authority. He simply stopped beside them and looked at the folder. "What is this?" he asked. "A routine acknowledgement," the administrator replied quickly, "to clarify that she acted independently." The official's gaze shifted to Mara. "Did you?" he asked. "Yes," she answered. The administrator nodded sharply, seizing on it. "You see," she continued, "because delay would have cost oxygenation beyond recoverable threshold." The defense official looked back at the administrator. "She prevented a fatal collapse," he said evenly. "That is a clinical opinion," the administrator replied. "No," the official said, "that is an operational fact." The hallway air shifted again. The resident attempted to reclaim footing. "She compromised chain of command. That matters." The official turned slightly toward him. "Chain of command exists to protect mission success," he said quietly. "Not ego." The resident went still. Then the official faced Mara fully. "What do you want?" he asked. "Not what are you owed, not what compensation, just what do you want?" Mara's eyes flicked once toward the trauma bay doors. "Is he stable?" she asked. "For now," the official said. "He will transfer once weather clears." "And exposure?" she asked carefully. "Contained," he replied. She nodded. "That's enough." The administrator stared at her. "You're refusing to defend yourself?" "I documented," she said. "That isn't the same." "It is," she replied. There was no anger in it, just fact. The defense official studied her for a moment longer. "You left service voluntarily," he said quietly, "after the Kandahar extraction." The administrator blinked, confused by the name. Mara's expression did not change. "Yes," she said. "Why?" the official asked. Not for the hallway, but for her. She answered without looking at him. "Because I made a call that saved the convoy," she said, "and cost a man his leg." The hallway felt narrower. "It was the right call," the official said. "It was the only call," she corrected. Her voice remained even. "No one died," he added. "One did later," she said softly. "From complications. I signed the recommendation that put him in that vehicle." The resident shifted, uncomfortable now. "That is war," the official said. "It is consequence," she replied. Silence settled heavily between them. She continued, still calm. "I left because I do not argue over decisions made under oxygen deprivation and time compression. I do not defend correct actions to people who were not there." Her eyes lifted briefly to the administrator. "I will not sign that statement." The administrator inhaled sharply. "Then we proceed formally." "Proceed," she said. The defense official stepped forward half a pace. "There will be no formal action against her," he said evenly. "Any review will include federal oversight." The administrator went pale. The resident looked down. The official's tone never rose. He turned back to Mara. "You could walk away again," he said. "Disappear cleanly. No paperwork follows you." She considered it. It would be easy. She had practiced vanishing. Hospitals existed everywhere, new badges, new silence. Or she could leave one record corrected, one chart clean, one instance where ego did not win. Her internal calculus aligned. She looked at the administrator. "Update the chart," she said. "Accurate timeline, accurate intervention, no embellishment." "And your termination?" he asked stiffly. She paused. "I don't need reinstatement," she said. "I need the record correct." The resident stared at her. She met his gaze briefly. "You were scared," she said, not cruelly. "Next time, listen sooner. No lecture, no performance, just truth." The defense official watched her closely. She had chosen. Not spotlight, not revenge. Correction, minimal, clean. The administrator slowly closed the folder. The pre-written statement remained unsigned. In the trauma bay, the patient's monitor continued its steady rhythm. Mara adjusted her badge once. She did not smile. She did not celebrate. She had not returned to service, but she had refused to disappear. And that, in its own quiet way, cost more than the save itself. The conference room was smaller than it needed to be. No windows. Frosted glass door. Fluorescent panel humming faintly overhead. The defense official stood at the head of the table, not seated. The hospital administrator sat rigidly, hands folded too tightly. The chief resident leaned back, trying to appear composed. Mara stood near the wall, not at the table, not claiming space. The attending physician had been called in as well. He avoided her eyes. No one raised their voice. That made it heavier. "We are not here for theater," the defense official said calmly. "We are here for accuracy." A folder rested on the table. Not hospital-branded. Government seal embossed faintly in one corner. The administrator cleared his throat. "We value collaboration, but internal staffing decisions—" "Stop," the official said quietly. He did not increase volume. He did not repeat himself. The administrator stopped. The patient is not simply a private citizen, the official continued. He is part of an active protective structure. Your internal decision to remove Nurse Quinn compromised that structure. The chief resident shifted. She acted without authority. She acted with correct sequence, the official replied. The door opened softly. 2 security officers escorted the patient in a wheelchair. Pale, IV lines in place, civilian clothing draped over hospital gown. His posture was controlled despite visible fatigue. He did not look at the administrator. He looked at Mara. The official nodded once to him. "You are stable enough?" he asked. "For this," the patient replied quietly. His voice was steady, military cadence beneath civilian tone. He faced the room. "At 02:14, he said, my pressure dropped under 80 systolic. The attending blinked. "You were not fully conscious." "I was," the patient said evenly. "Enough." He turned his head slightly toward Mara. She corrected the sequence. "You delayed." The chief resident stiffened. "That is not accurate," the patient continued. "She warned about the internal bleed pattern before imaging confirmed it. You dismissed it." Silence. He looked directly at the resident now. "You raised your voice at her, not at the hemorrhage." The words landed without volume. The administrator shifted uncomfortably. "This is not a military tribunal." "No," the defense official agreed. "It is a hospital review, which is why we require documented accuracy." He slid a printed sheet across the table. Vitals timeline, time-stamped, highlighted. Mara stepped forward once. "I can clarify sequence," she said. "No emotion, no defense, just process." The official gestured slightly. She moved to the table but did not sit. "At 02:09, she began, voice even. "Oxygen saturation fell 3 points without corresponding respiratory distress. That indicated internal pooling." She pointed once to the chart. 02:12, heart rate spike inconsistent with surface injury. I recommended cross-match prep and imaging priority. She did not look at the resident. At 02:14, pressure decline began. Intervention initiated at 02:16. The attending's jaw tightened. "You were not authorized to initiate that line," the chief resident said. She met his eyes calmly. "If I had waited for authorization, he would have coded at 02:18. No accusation. Just math." The defense official leaned back slightly. "The timeline is confirmed," he said. The administrator pressed his fingers against his temple. "Even if clinically correct, there are chains of command." "Chain of command failed," the patient said quietly. The room stilled. The official's gaze hardened, but only slightly. "National risk," he said, looking at the administrator, "is not theoretical. A mismanaged death tonight would have triggered investigative review at levels you are not prepared for." The weight of that sentence was not loud. It was final. The chief resident inhaled sharply. "Are you threatening?" "I am explaining consequence," the official replied. No more words were needed. The administrator's composure thinned. "What resolution are you proposing?" he asked carefully. The official answered without pause. "Correct the record. Remove termination. Remove the resident from this case pending review. Implement procedural audit on escalation protocol." The chief resident's face drained of color. "That is disproportionate." "It is precise," the official corrected. The attending remained silent. Mara stood still, hands loosely folded behind her back. Internal calculation steady. The administrator exhaled slowly. "Termination reversed," he said at last. Silence followed. It should have felt like victory. It did not. The official looked toward Mara. "Reinstated immediately," he added. She shook her head once. The movement was small. "No," she said. The administrator blinked. "You just argued for correction." "For the record," she replied. "You are refusing reinstatement?" the chief resident asked, incredulous. "I am declining employment under conditional apology," she said calmly. The official studied her. "This hospital will adjust," he said. She met his gaze. "Maybe," she answered, "but I will not remain as proof." The room absorbed that slowly. She continued, voice level. "I do not work where patient safety competes with ego." The attending finally spoke, quietly. "You would walk away again?" "Yes." Not angry, not dramatic, just certain. The defense official nodded once. "Your record will reflect correct action," he said. "That is sufficient," she replied. The patient shifted slightly in the wheelchair. He looked at her, not with gratitude, but with recognition. "You were right," he said simply. She inclined her head once. The official closed the folder. "No one here is in charge," he said quietly to the room. "Not tonight." It was not insult, it was fact. The administrator looked smaller in the fluorescent light. The chief resident looked younger. Mara stepped back toward the wall. She had corrected the record. She had prevented a scapegoat narrative. She had not raised her voice. And now she was choosing to leave on her own terms. The door opened softly. She walked out before anyone could reframe the outcome. No applause, no final word, just controlled exit. In the hallway, the ER hum resumed, unchanged, except it was not. Dawn came without color. The rain that had battered the ambulance bay all night softened into a thin mist. Water clung to the parking lot in shallow pools, reflecting the pale grey sky. The ER lights were still harsh inside, still humming, but the edge had dulled. Exhaustion replaced adrenaline. Monitors continued their steady rhythm. A gurney wheel squeaked down the hallway. Someone laughed quietly at something small and ordinary. The building had survived the night. That was enough. Mara stood near the nurses' station, no longer assigned to a bay. Her badge had been deactivated an hour earlier. No one had taken it from her yet. Inside a glass-walled office, the administrator and chief resident sat over a laptop. The incident report glowed on the screen. Words shifted. Phrases softened. Miscommunication replaced wrong sequence. Process review replaced error. Mara watched only once, then looked away. She did not argue. She did not request correction. Credit diluted itself easily in fluorescent light. The attending physician stepped out of the office and paused near her. He opened his mouth, then closed it again. Whatever apology had formed did not survive contact with her calm expression. She nodded once. He nodded back. It was enough. Footsteps approached from the corridor that led toward the secured wing. The defense official moved without urgency. His jacket was draped over one arm now. He looked less like authority and more like fatigue wrapped in discipline. He stopped in front of her. There was no audience, no administrator, no resident, just the low hum of the nurses' station and the sound of rain thinning against the glass. "You did what needed to be done," he said. One sentence. No praise, no ceremony. She met his eyes briefly. "Yes, sir." He studied her a moment longer. "You are certain," he asked quietly, "about leaving?" "Yes." No hesitation. He inclined his head once. "If you change your mind," he said, "we know where to find you." She did not respond to that. Instead, she asked the only question that had mattered since the gurney rolled in. Did he live? The official held her gaze for a beat longer than necessary. Yes. Nothing more. No elaboration on transfer status. No discussion of ongoing risk. Just confirmation. She nodded once. A small breath left her chest. Not relief, not triumph, just recalibration. "Good," she said. He stepped aside, giving her clear path toward the exit. In the trauma bay, the sheets had been changed, supplies restocked. It looked like any other night shift that had ended badly and then recovered. The chief resident avoided her completely now. A nurse from another pod approached her cautiously. "Are you going to fight this?" she asked in a whisper. Mara shook her head. No, but you were right. I know. No edge in her voice, no need to defend it. She walked toward the locker room, each step measured, shoulders level. Inside, the fluorescent light felt colder. She opened her locker and removed her bag. The tremor in her hands had returned slightly now that the pressure was gone. Adrenaline always left its residue. She reached into the small interior pocket. Her fingers brushed against metal. Cold, worn, a Ranger coin, edges smoothed from years of quiet handling. She held it in her palm for only a second, not long enough to drift into memory, long enough to confirm it was still there. Then she slipped it back into the pocket and zipped it closed. No display, no ceremony. Back in the hallway, the night shift was transitioning. Day staff began filtering in, unaware of the full weight of what had happened. The administrator's office door closed firmly behind him. The rewritten report would circulate. The story would soften. Her name would appear only where legally necessary. Mara walked past the nurses' station one final time. No one stopped her. A tech offered a small nod. She returned it. The defense official stood near the exit doors, speaking quietly into a phone. He ended the call as she approached and stepped aside. The automatic doors opened with a soft mechanical sigh. Cold morning air met her face. The parking lot was nearly empty. Government vehicles were gone. Only a few staff cars remained under the thinning mist. She stepped off the curb and paused for a moment. Not to look back, just to breathe. The building behind her hummed steadily, indifferent and unchanged. She had arrived unseen. She was leaving the same way. But somewhere inside, a patient was alive because she chose discipline over pride. Somewhere inside, a record had been corrected. And somewhere in a secure file, her name would remain attached to a decision made without ego. She walked toward her car. No spotlight, no applause, just quiet competence carried forward into whatever came next. As she reached the driver's door, she touched the coin once through the fabric of her bag. Then she let her hand fall. The rain stopped completely. She drove away as the sun began to press faint light against the horizon, unseen by most, not unknown to the people who mattered.